So this next topic, we need to go serious for a moment because we all know that mistakes can happen, and a mix-up at University Medical Center in Lebanon, Tennessee led to a surgical procedure being performed on the wrong newborn baby. So Jennifer Melton gave birth to baby Nate. He was perfectly healthy, but not long after birth, her newborn went for a routine physical. A couple of hours later, he was brought back to her. The nurse started to mention the procedure they had done and that they had clipped his tongue. Somehow a doctor, without the parent's signed consent, had performed the procedure on Nate that was actually meant for another child. And that procedure was called a frenulectomy, and that involves cutting that flap of skin under the tongue. Now, you know, this is not it's uncommon, but these things have happened before because obviously babies, we've talked about parents taking the wrong babies home. When I first heard about this, I didn't know what surgery had been performed. I was thankful that this was the one rather than some, you know, we removed the kidney of the wrong baby because Dr. Ordon, the outcome should be good here.
Frenulotomy, we all have that little frenulum. It's that little ridge of tissue at the base of the tongue. For kids that have tongue tie, ankyloglossia, that adhesion is a little extended. It's a simple little thing to do. You just nip it and you're done. The fact that it was done on somebody who really didn't have...
Yeah, I mean, wouldn't that be one red flag when the surgeon looked in the mouth and said, doesn't really look that bad?
Well, we all have it. Maybe this other child had it to a certain degree too, but in the long run, I don't foresee any difficulties with this child in terms of speaking, using their tongue, chewing, swallowing.
But I think it's bigger than that, though. I think it's more so you have your child, they're in the nursery, you know, you're down the hall or on a totally different floor, and then someone comes in and tells you that you accidentally performed a surgery on the child that they didn't need. So I think it's more of an emotional response. Like, how do things like this even happen?
Well, I want to tell you how things normally happen because I've done thousands of circumcisions on newborn babies in the hospital. And the parents are not there because it is a surgical procedure, and sometimes they'll ask if they can watch, and the answer is no, just like I wouldn't watch, you know, my child now undergo an operation. But it is like Fort Knox military submarine checkpoint to do that procedure. The surgeon, in this case me, takes the baby, unwraps the baby, picks up the baby's ankle. The nurse is standing right there with the signed surgical consent and says, okay, this is baby boy Smith, medical record number 1234567. And I say, this is baby boy Smith, medical record number 1234567. We do that twice. It's called a surgical timeout. It's a standard of care. So when I heard this story, I thought, what was the surgeon doing? What was the nurse doing? We don't just, I don't want people to think that we're walking around the hospital and we grab a baby.
I'm guessing this is such a minor thing.
That's what I'm guessing.
This may have been done. This may have done exactly in the bedside.
Definitely.
So that checklist that is always in place in the operating room.
Yeah, because this isn't a big, formal, massive surgery.
Do this in the clinic.
This is a, you know, Drew, probably takes you how long to do this? 5 seconds?
Yeah. Yes.
So it's a 5-second procedure. So, I mean, it doesn't excuse anything, but it maybe helps explain how it could even happen in the first place.
Really?
The doctor did apologize, obviously. Didn't make any excuses. But, you know, one of the things we always talk about in medicine, anytime you introduce humans into an equation, errors can happen. And errors do happen. And all you can do as a patient or a parent is be as vigilant as possible because, like Dr. Ashton said, we do have checklists in place. But if you have a sneaking suspicion that maybe your child is being taken to go somewhere and you don't know why, it is okay to raise your hand and say, well, now, what's this for exactly?
Yeah.
You can ask questions. There's no rule in a hospital that says you can't ask questions as to what they're doing with you or your baby, just to make sure that something like this hopefully never happens in your world.